when was the last time you looked down at your feet and really thought about the health of your heart?
I mean, probably never. Right.
Right. But today is Monday, March 9, 2026, and we are doing a deep dive into a surprisingly interconnected world. We're looking at the intersection of foot health, medical entrepreneurship, and digital well-being.
Yeah, it's a really fascinating mix. We are pulling from an insightful interview on a YouTube show called Health Matters. The host, Pete Kane, sits down with Dr. Candice Escalea. She's a board-certified podiatrist and the founder of Prestige Ankle and Foot Care.
And what makes this source material so compelling is that it doesn't just stay in the medical lane.
Right. It really explores the hidden challenges of building a practice from the ground up and, how to maintain your humanity in a highly digital, highly demanding world.
Okay, let's unpack this. Starting with Dr. Escala's origin story, because it really sets the stage for everything she does. She grew up in a small town in Georgia and knew from a very early age that she wanted to be a doctor.
Yeah, there was no plan B for her.
Exactly. But the pivot to podiatry specifically happened during her pre-med undergrad years in New Orleans. She shadowed a podiatrist, and the immediate impact of the work just grabbed her.
Oh, for sure. Patients would walk into the clinic in absolute agony, like barely able to put weight on their heel.
And then walk out that same afternoon experiencing total relief.
That ability to facilitate an instant transformation, that became the driving force of her career. So she spent about 18 years working in various corporate medical settings and private practices.
Which is a long time to be in that system.
It is. And over time, the structural limitations of those larger organizations started to chafe. She had this very specific vision for comprehensive patient care, but she wasn't in a position to shape that experience.
Right, the bureaucracy was getting in the way of the medicine.
Exactly. So she took a massive leap of faith. She packed up her life in Texas, moved all the way back to her home state of Georgia, and launched her own practice.
Man, that takes an incredible amount of nerve. But before we dive into the business side of that leap, we really need to look at the medical insights she shared. Because the way she approaches an examination is, frankly, fascinating.
She treats the foot as a window into your overall health.
Yeah, it essentially acts as a crystal ball for your body's most critical systems.
Right, because the feet are at the very end of the circulatory line. If there is a systemic issue, whether that's diabetes, hypertension, or severe heart disease, the symptoms often show up in the extremities first.
Because the blood flow gets compromised higher up.
Exactly, and the feet start ringing the alarm bells. Patients will come in thinking they just have a nagging ache in their arch, and she ends up identifying the early markers of cardiovascular disease.
Which is crazy to think about. I always assumed that if you had a serious circulation problem, it would be incredibly obvious.
Like what?
You would expect to see massive swelling, or severe discoloration, or bulging veins.
What's fascinating here is that the most dangerous circulation issues often do not present visually in the early stages.
Really? Nothing at all?
Nothing. You can look down at your foot and see perfectly normal skin, no swelling, and a completely normal shape. The warning sign presents purely as a specific type of pain known as claudication.
Claudication?
Yes, it's a distinct, deep cramping in the calves or the arches. And it occurs reliably when you walk a certain distance and then magically disappears the moment you sit down and rest.
Sounds like something you would easily brush off as just being out of shape or, I don't know, needing to stretch more.
And that is exactly why it goes ignored for so long. People think it's just a muscle cramp. But it is a red flag that your arteries are struggling to pump oxygen-rich blood all the way down to your extremities when the muscles demand it during activity.
Wow.
Dr. Escala notes that by just taking a thorough patient history and listening to how they describe the timing of that pain, she knows she needs to check their vascular status immediately.
Because catching those invisible signs early gets that patient referred to a cardiologist for intervention.
Right, before they suffer a catastrophic event like a heart attack or a stroke.
You have to consider how that kind of foot pain, even before a diagnosis, completely halts a person's life. It isn't just a minor inconvenience. A painful foot dictates your entire day.
It really does.
You stop cooking because standing in the kitchen hurts. You decline invitations to go out with friends because you know that within 10 minutes of walking, you're going to be miserable. Your world shrinks down to the places you can reach without triggering that pain.
And because foot pain is so ubiquitous, the profession dedicated to treating it is often fundamentally misunderstood by the general public.
Oh, the toenail clipper myth.
Yes.
Dr. Escala says the most common misconception about podiatry is that people assume the job just consists of trimming sick nails, filing down calluses, and handing out inserts.
But the reality of the profession involves high-stakes, specialized medicine. Every podiatrist undergoes intense surgical training.
They're actual surgeons.
Fully equipped surgeons capable of performing complex reconstructive procedures by the time they finish their residency. They manage severe diabetic wound care, sometimes performing skin grafts or amputations to stop the spread of infection.
Which is incredibly serious work.
They are also on the front lines of dermatology. If you have a suspicious, irregular mole on the sole of your foot or under a toenail, the podiatrist is frequently the one diagnosing and surgically excising that melanoma.
But a massive part of avoiding the podiatrist's surgical chair comes down to our daily habits. Here's where it gets really interesting. The mechanics of what our shoes are actually doing to our biology is a harsh reality check.
Oh, absolutely.
We all know high heels aren't comfortable, but the physical changes they force on the body are severe.
Pointed toe shoes and high heels act like a mechanical funnel. If you continuously wear them, you are actively precipitating deformities by fundamentally altering your bone structure over time.
Because you're jamming your foot into that shape.
Right. You are physically pushing the big toe inward, which promotes the growth of bunions, those painful bony bumps on the joint. Or you force the middle toes to buckle and curl under permanently, creating hammer toes. It is a biomechanical nightmare.
I have to admit, I'm completely guilty of the next footwear trap she mentioned.
Oh.
I will wear slides and flip-flops all summer long, and then wonder why my shins, ankles, and arches are throbbing by the end of August.
The flip-flop physics.
The flip-flop physics she described blew my mind.
Think about the gait cycle. Because a flip-flop or a slide has no back, the shoe has no natural way to stay secured to your heel when you lift your leg.
Okay.
To compensate, your foot's tendons are forced to work double time. With every single step, during the swing phase of your stride, you are subconsciously gripping the footbed with your toes just to keep the shoe from flying off.
That's the crazy part. You don't even realize you are clawing at the shoe.
You don't. But those tendons are under constant, repetitive tension. Over weeks and months, that subconscious gripping leads directly to tendinitis and severe chronic pain around the ankle and the plantar fascia.
So a completely ordinary, seemingly harmless choice in footwear creates a chronic orthopedic issue.
Exactly.
That idea of ordinary choices compounding over time applies perfectly to Dr. Escala's entrepreneurial journey, too. Building prestige ankle and foot care from scratch required an immense amount of calculated risk.
It did. But she was very strategic.
Right. She didn't want to dig a massive financial hole right out of the gate by signing a huge commercial lease. She kept her overhead extremely low by launching as a mobile clinic.
Which is so smart.
She drove out to do home visits and provided care at assisted living facilities to build her patient base before she ever opened a physical office.
That phased approach is a brilliant survival tactic in medical entrepreneurship, because transitioning to a brick-and-mortar operation is where the unexpected administrative burden hits hardest.
They don't teach you that in medical school.
Not at all. Medical school teaches you anatomy, pharmacology, and surgical techniques. It does not teach you how to navigate complex state regulations for installing an X-ray machine in a commercial space.
Right, which requires lead-lined walls and specialized health department inspections.
Suddenly, she is buried in managing payroll, renewing business licenses, and handling complex insurance billing.
So how does a solo practitioner navigate that transition without burning out completely?
If we connect this to the bigger picture, her strategy is the absolute core of effective business leadership. Delegate to specialists.
Give up the control.
Yes. When she reached out to another podiatrist who'd already walked that path, the advice was to stop trying to figure out legal compliance or specialized equipment regulations alone. You have to give up a little bit of control and hire experts in those specific fields.
Because trying to be your own accountant, HR department, and compliance officer while also seeing patients all day is a guaranteed recipe for failure.
Absolutely.
A beautiful side effect of her stepping into that CEO role is the impact it's having on her 8-year-old son.
That was such a great part of the interview.
She used to try and explain the concept of leadership to him. Now, he is absorbing it just by watching her operate. He asks questions about her employees, the business structure, and how she makes decisions.
He is internalizing real-world leadership skills and financial literacy simply by observing his mother navigate the challenges of running a company.
It's incredible. But to manage the dual demands of being a present mother and a full-time medical CEO She leans heavily into artificial intelligence.
We hear constant buzz about AI disrupting industries, but seeing the practical application in a small medical practice grounds the conversation.
She is using AI as a tool to preserve her work-life balance and combat the most notorious cause of physician burnout: administrative charting.
The paperwork.
Historically, the paperwork is a crushing burden. There is a well-known phenomenon in medicine called pajama time.
Pajama time.
Yeah, where doctors see patients all day, go home, put their kids to bed, and then spend 3 or 4 hours in their pajamas typing up clinical notes.
It's exhausting. But Dr. Escala completely bypassed that trap by implementing advanced AI dictation software. The AI listens to the patient encounter and dictates her clinical notes in real time, structuring the medical data perfectly.
That is life-changing for a doctor.
It drastically reduces the hours spent staring at a screen, allowing her to leave the office when the clinic closes and actually be fully present with her son.
And she didn't stop there.
No, she also deployed an AI chatbot on her practice's website. So if a patient is up at midnight experiencing foot pain and wants to know if she treats diabetic ulcers or how to book a consultation, the AI agent is there to answer those queries instantly.
It provides immediate connection and captures that patient's information without demanding her personal time on a Saturday night.
Using technology to buy back your time is a massive win. But Pete Kane and Dr. Escala spent a significant portion of their interview discussing what we do with that time once we get it back.
Right. The conversation shifted toward how we connect with the earth, with each other, and with our own minds. Pete brought up the incredibly popular wellness trend of grounding.
Grounding, or earthing, is the practice of walking completely barefoot outdoors, on grass, dirt, or sand, to physically connect your body to the earth.
People swear by it.
They do. Proponents swear by its magical ability to reduce inflammation and improve sleep.
It sounds idyllic, but Dr. Escala provided a very necessary medical reality check.
From a podiatry standpoint, she explicitly advises against grounding for a large portion of her patients.
Oh, really?
Yes. If you are a diabetic, or if you have the poor circulation issues we discussed earlier, walking barefoot outside is incredibly dangerous.
Because of the lack of feeling.
Exactly. Neuropathy often accompanies those conditions, meaning you lose sensation in the bottom of your feet. You could step on a piece of glass, a sharp rock, or a thorn and not feel a thing.
And if you don't feel it, you don't treat it.
And because your circulation is compromised, that unseen cut won't heal properly, leading to a severe limb-threatening infection.
She did clarify that for healthy individuals without structural or vascular issues, she approves of minimalist shoes. Footwear that offers a thin layer of puncture protection, but still lets your foot articulate and feel the contours of the ground.
But true barefoot grounding is a major medical risk for vulnerable populations. It all comes back to knowing your own biology and the risks you carry.
That physical disconnect from the earth is paralleled by our psychological disconnect from each other, driven largely by our screens. Pete Kane highlighted a staggering statistic during the interview.
This one was tough to hear.
The average American watches 4 hours of television and scrolls social media for 2.5 hours every single day.
That is 6.5 hours of pure digital consumption. We're spending over a quarter of our lives passively consuming content rather than actively creating things.
Whether that is building a business, cultivating a garden, or fostering meaningful friendships. Pete shared an anecdote that perfectly captures how deeply ingrained this behavior has become. He was sitting in a waiting room while recovering from a hernia surgery. Out of the 18 people in that room, 16 of them were entirely glued to their digital devices.
You have a room full of people physically sharing a space, but completely isolated in their own digital worlds. It has become our default state of existence in public.
Pete contrasted that slightly dystopian waiting room scene with a story about a woman in his local Rotary Club. When this woman goes out to dinner with her husband, she actively scans the restaurant for families who are sitting around a table actually talking to each other.
Looking for parents and kids engaging in meaningful conversation without a single phone in sight.
Exactly. And when she spots them, she secretly pays for their meal and leaves a card, encouraging them to keep connecting. She is financially rewarding analog human connection because it has become remarkably rare.
That story highlights the necessity of intentionally designing your own wellness habits and drawing hard boundaries around your attention. Dr. Escala is highly intentional about how she unplugs to combat that 6.5 hours of default consumption.
She has to be with her schedule.
She actively backs away from watching negative television and news broadcasts. She operates on the principle that you cannot constantly consume negativity and expect to maintain positivity and resilience in your life and your business.
She replaces screen time with green time. She is a huge advocate for trail walking, getting out into nature by herself, elevating her heart rate, and using the quiet to completely decompress from the clinical environment.
She also spends time gardening. She finds that the simple, quiet, tactile act of working with the soil gives her mind the space to wander.
It sparks creative thoughts and new ideas for her practice that she would never access if she were mindlessly scrolling a feed.
While perhaps her most grounding daily habit has nothing to do with nature or technology, it is purely about human connection.
The phone calls.
Yes. Every single day, she makes it a point to call and sit on the phone with her mother. They don't have to discuss anything profound or solve any major life problems.
Just the act of hearing her mother's voice and sharing that dedicated time is an anchor. It provides genuine connection in a world that is always trying to fragment our attention.
Building on that idea of mental anchors, Pete Kane shared his own brilliant strategy for managing the psychological weight of running a business. He calls it the 3 wins strategy.
Because our human brains have a deeply ingrained negativity bias.
Right. We are hardwired to remember the one frustrating client or the one mistake we made today and completely disregard the 50 things that went perfectly right.
To counteract that biology, Pete forces himself to write down 3 specific wins every single day, no matter how exhausting or difficult the day was.
By actively documenting and celebrating those small victories, he anchors his mindset in progress. When he hits a wall or has a terrible week, he can look back at 3 years of documented wins and physically see his forward momentum.
It is an incredibly effective way to rewire your brain to look for the positive, which is essential when you are pouring all of your energy into taking care of other people.
You cannot pour from an empty cup.
So what does this all mean? As we wrap up this deep dive, Dr. Escala's final plea to the listener was uncompromising. Listen to your body.
It sounds simple, but it's profound.
We spend so much of our energy proactively trying to take care of our families, building our careers, and supporting our friends. But if your body is sending you pain signals, whether that is an ache in your arch from wearing slides all summer, or a specific cramping in your calf signaling a vascular issue, and you choose to ignore it, you are eventually going to crash.
You cannot show up for the people you love if you refuse to show up for your own health.
The small choices, like the shoes you put on your feet and the amount of screen time you consume, dictate the quality of your life.
This raises an important question for all of us to consider as we close out today's deep dive. We are living in an era where we constantly look to external technology to tell us how we are doing.
The smartwatches and the rings.
Right. We strap on smartwatches, we download AI health trackers, we obsess over complex sleep data and step counts, waiting for a screen to validate our health. But what if the most sophisticated, high-tech, deeply interconnected early warning system we will ever own is already built right into the soles of our feet?
Are we so busy staring down at our glowing screens that we have completely forgotten how to read the brilliant biology of our own bodies?
It's a powerful thought.
That is a thought to carry with you this week. Take a moment, unplug, and genuinely listen to what your body is trying to tell you. Thank you so much for joining us on this deep dive. We hope you found some aha moments today. Keep exploring, stay intensely curious, and take a really good look at what's supporting you, literally and figuratively, every single day.